Atlantic started in Vietnam in 1998 when Chuck Feeney, the founding chairman, paid a visit there and actually walked through the central hospital in Da Nang.
When he got to the hospital, he sees this huge infrastructure, dilapidated, poorly kept, severely overcrowded. And so he started helping them, rebuild the department, give them more equipment. But the more we do that, it's like build it and they will come, because the bigger the hospital we build, the better the hospital, the more overcrowded it became, because there's nothing else in the region. Then we have to start thinking, why is that? And how can we solve this problem? Because we can't go on building bigger and bigger hospitals. The answer lies in reforming the system, especially the system of healthcare below the tertiary level, at the primary level.
It started with building better facilities. It moved to building talent and skill of the people within those facilities. It then moved to building a culture of public health, of prevention and primary care that was weak or non-existent before. All of those things together, each of them a higher level of intervention, adds up now to a system that is improving, at least, for every one of the 80 million Vietnamese people who used to get inadequate care and now have some hope of getting better care.
It's never easy to assess impact, especially when you're talking about system change, because the impact of a system change is changes in the system, which means that it will never stop changing. What we've done is give it a starting point where these services can be built upon. But we're not going to be around to know, and we're not going to be around to give them the resources to do this. They themselves have to respond to the needs, find the resources for it. But the whole idea is for them to realize that and to be able to do that.
Chuck Feeney went into Vietnam intending to improve the physical environment of both the universities and the healthcare system. His intent was to make a difference in the physical infrastructure of Vietnam. What made the Foundation's contribution to Vietnam so important and so broad and so historic is that narrow experience from the beginning of Chuck Feeney's time there taught them lessons that gradually broadened their institutional approach to Vietnam, that helped them learn from the Vietnamese people and government and helped them contribute back additional ideas and bring in additional resources, none of which was contemplated at the beginning.